You wake up before the rest of the house. The kitchen is quiet, the kettle goes on, the oatmeal comes out, and for a few minutes, the morning belongs entirely to you. It is a routine so familiar that you rarely think about it anymore. Just breakfast, just habit. But what if that bowl, the one you have been making for years, is closer to a genuine act of heart care than you ever realized? And what if one small addition, something inexpensive and easy to find, could make it quietly more powerful than anything you have been putting in it so far? That is exactly what we are going to talk about today. Not a supplement, not a prescription, not another complicated health protocol that requires a spreadsheet to follow. Just a simple ingredient and the real science behind why it may matter more than most people over 70 have ever been told. Before we go further, a brief note. Everything you hear in this video is for educational purposes only. It is not medical advice, and it is not a substitute for a conversation with your own doctor. Always consult your physician before making changes to your diet, especially if you are managing a health condition or taking any medications. Now, let us start with what is actually happening inside your arteries and why it begins long before anyone notices. Cholesterol has one of the worst reputations in medicine, and most of it is unfair. Your body needs cholesterol. It uses it to build and maintain cell membranes, to produce hormones like estrogen and testosterone, to support brain function, and to help the liver make bile for digestion. The liver manufactures most of the cholesterol in your body on its own. It is not a foreign substance. It is something your body has always relied on. The problem is not cholesterol itself. It is a question of balance and of transport. Cholesterol does not dissolve in blood. To travel through the bloodstream, it needs to be packaged inside carrier proteins called lipoproteins. You have likely heard of two types: LDL, or low-density lipoprotein, and HDL, or high-density lipoprotein. LDL carries cholesterol from the liver out to the tissues of the body. HDL, on the other hand, collects excess cholesterol and brings it back to the liver for processing and removal. When LDL levels rise, whether due to genetics, diet, reduced physical activity, or changes in how the body processes fats as it ages, there is simply more cholesterol circulating in the blood than the body can efficiently clear. Over time, that excess LDL can begin to work its way into the inner walls of arteries. The immune system responds to this as it would to any intrusion, with inflammation. White blood cells rush in. Fatty deposits accumulate. The area hardens and thickens. This process is called atherosclerosis. The thickened deposits are what doctors refer to as arterial plaque. And the reason it is so easy to miss for so long is that none of it causes pain in the early stages. The arteries are remarkably adaptive. They can compensate for significant narrowing, sometimes for decades, before any outward symptoms appear. By the time a cardiovascular event occurs, the process behind it has typically been building quietly for many years. This is not meant to alarm you. It is meant to explain why the small, consistent choices you make every single day, including what goes into your breakfast, carry more weight than they might appear to. Now here is where your morning oatmeal becomes genuinely interesting. Oats contain a naturally occurring type of soluble fiber called beta-glucan. When you eat oatmeal, beta-glucan absorbs water in the digestive tract and forms a thick, gel-like substance. That gel moves slowly through the intestines, and along the way, it binds to bile acids, compounds that your liver produces using cholesterol to help digest fats. Normally, most of those bile acids would be reabsorbed at the end of the intestine and recycled. But when beta-glucan is present, it physically traps bile acids and carries them out of the body before they can be reclaimed. The liver, sensing a shortage, draws cholesterol from the bloodstream to manufacture new bile acids. The result? LDL cholesterol levels in the blood may fall. This is not a theory. The FDA has recognized oats as a food that may support heart health when consumed regularly as part of a balanced diet. Multiple peer-reviewed studies have associated a daily intake of around 3 grams of beta-glucan, roughly the amount in 1.5 cups of cooked oatmeal, with modest but meaningful reductions in LDL cholesterol. The effect is not dramatic. It is not the kind of number that makes headlines. But it is real, it is consistent, and it happens morning after morning, over months and years, without side effects and without a prescription. That is the kind of quiet arithmetic that adds up over a lifetime. But the oats alone are only one part of what that bowl can do. What you add to it may matter every bit as much. Consider someone. A retired teacher, perhaps, in her early 70s. She has eaten oatmeal on and off for most of her adult life. Her last checkup flagged her LDL as borderline high. Not at the level her doctor wanted to treat with medication yet, but worth watching. She adds a handful of blueberries, a little honey, and moves on with her morning. What she has never been told is that 2 tablespoons of ground flaxseed stirred into that same bowl could be quietly doing something her oats alone cannot. Ground flax seeds are one of the richest plant-based sources of alpha-linolenic acid, an omega-3 fatty acid. They also contain lignans, plant compounds with antioxidant properties that have been studied for their potential role in reducing inflammation and supporting hormonal balance. And they carry their own substantial supply of soluble fiber, adding to the cholesterol management effect already initiated by the oats. Research suggests that regular consumption of ground flaxseed may help reduce LDL cholesterol, may support healthy blood pressure levels, and may lower certain markers of inflammation in the body. All 3 of these factors are directly connected to long-term cardiovascular health. In some studies, daily flaxseed supplementation over several weeks was associated with LDL reductions comparable to those achieved by dietary interventions that were considerably more complex and demanding. There is one detail that matters enormously here, and it is one that most people get wrong. The flax seeds must be ground. Whole flax seeds have a tough outer shell that the human digestive system cannot break down. They pass through largely intact, and most of their nutritional value goes with them. Ground flaxseed, also called flaxseed meal, is what the research consistently uses, and it is what actually makes a difference. It is widely available in grocery stores, often in the natural foods or baking aisle. 2 tablespoons per day is the amount most commonly examined in clinical studies. It has a mild, slightly nutty flavor that blends easily into warm oatmeal without dramatically changing the taste or texture. One practical note: once opened, ground flaxseed should be stored in the refrigerator or freezer. Because of its high polyunsaturated fat content, it can oxidize and go rancid relatively quickly at room temperature. A fresh bag smells faintly nutty. If it smells sharp or bitter, it is turned and should be replaced. There is a second addition worth considering. It may already be sitting in your spice cabinet, largely ignored, and it has a longer history in traditional medicine than almost anything else we could name. Cinnamon has been used across cultures for thousands of years, both as a flavoring and as a remedy for a wide variety of conditions. In recent decades, researchers have taken a closer scientific look at what it might actually do in the body. Some studies have suggested that cinnamon may help support healthy blood sugar levels by improving how cells respond to insulin, a finding that is particularly relevant for older adults, since insulin sensitivity tends to decrease with age. Other research has found associations between regular cinnamon consumption and modest reductions in total cholesterol and LDL cholesterol, particularly in people who already have elevated blood sugar or type 2 diabetes. The evidence is still developing, and the effects are not consistent across every study. Cinnamon is not a treatment, and it should never be used as a replacement for medication or medical guidance. But as a small, flavorful addition to a heart-conscious diet, it carries a meaningful track record and very little risk for most people. There is one distinction worth making, however. Most of the cinnamon sold in grocery stores is the cassia variety, which is darker in color, sharper in flavor, and contains a compound called coumarin. At high doses over time, coumarin can affect liver function. Ceylon cinnamon, sometimes labeled true cinnamon, contains far lower levels of coumarin and is generally considered the safer choice for regular use. Ceylon cinnamon is lighter in color, slightly sweeter, and more delicate in flavor. It is worth seeking out if you plan to make cinnamon a consistent part of your routine. A half teaspoon added to your oatmeal is a reasonable place to start. Here is a misunderstanding that is worth addressing directly, because it shapes the way many people approach this entire topic. There is a tendency to think about heart health as something that either requires dramatic intervention or delivers dramatic results. A major dietary overhaul, a new medication, a significant health scare that finally prompts a change. And because dramatic change feels like the only thing that would actually work, smaller habits can feel too modest to bother with. The biology tells a different story. Arterial plaque does not accumulate overnight. It builds through years of small decisions, not just one bad meal or one bad year, but the cumulative pattern of a lifestyle. The cardiovascular system responds to patterns, not events. And just as plaque builds slowly through sustained conditions that favor its growth, the conditions that support cardiovascular health are built the same way, gradually, consistently, and through choices that rarely feel significant in the moment. 2 tablespoons of ground flaxseed every morning will not undo decades of accumulation on its own. Nothing will, honestly, and anyone who tells you otherwise is not being straight with you. But as part of a broader dietary pattern that includes fiber, whole foods, healthy fats, appropriate physical activity, and regular medical monitoring, it is the kind of addition that may meaningfully shift the internal environment over time. The arteries respond to sustained patterns of care. They do not need a dramatic gesture. They need the same bowl, made a little better every morning. A few final practical considerations, because the details matter. If you take blood thinners, cholesterol-lowering medications, or any drugs that affect blood sugar, speak with your doctor before making ground flaxseed a daily habit. Flax seeds have mild blood-thinning properties and may have modest effects on blood sugar, which could interact with certain medications. This is not cause for concern. It is simply worth a clear conversation before you begin. When it comes to the oats themselves, steel-cut and old-fashioned rolled oats retain more of their natural beta-glucan than heavily processed instant varieties, which often have reduced fiber content and added sugars. If you prefer instant oats for convenience, and there is nothing wrong with that, choose an unsweetened, minimally processed variety and check the label before you buy. The combination to try: 1½ cups of cooked oatmeal, 2 tablespoons of ground flaxseed stirred in while it is still warm, and a half teaspoon of Ceylon cinnamon. Add fruit if you like. Keep the sugar light, and give it time, not days but weeks and months, before you evaluate how you feel. The heart is the one muscle in the body that never rests. It beats roughly 100,000 times every day, day after day, decade after decade, without being asked. It deserves the same quiet, consistent attention it gives you. Your morning oatmeal is already a good start. 2 tablespoons of ground flaxseed and a touch of Ceylon cinnamon make it something more. A small ritual with a larger purpose, repeated each morning, adding up slowly into something the body notices over time. The best moment to begin is the morning you already have planned. If this gave you something useful to think about, please consider subscribing to Prime Daily Health. And if you have questions or a topic you would like us to explore, leave it in the comments below. We are here and we read every one of them.